damage that is caused by vaping. It can lead to kind of that ground glass effect within the lungs. Common symptoms include shortness of breath, cough, chest pain, nausea, vomiting, and or fever. And this can progress over days or weeks, although they do find some patients are complaining of a sudden onset of illness. This can lead to respiratory failure. You may have heard that we have had vape-related deaths within the United States. None here currently in Washington, thankfully. Findings, abnormal chest x-ray or CT scans, which are on the screen, as I mentioned. And the suspected cause is some sort of chemical exposure that's within the vapor that they're inhaling when they're utilizing the vaping product. So when we're looking at cases for vaping illness, this is the case definitions, which I can get to if you're interested. So basically, it's pulmonary infiltrate on a chest x-ray, which has the ground glass opacities. And this is in the absence of any other infectious process. So they don't have, a bacterial pneumonia going on. They don't have a viral respiratory condition going on. All of these things have been ruled out. And then, other things that they're also looking at is the use, obviously, of vaping products in the 90 days prior to the symptom onset. So this is from the CDC. This was most recently updated on the 15th. I did check this morning, and this is still the current map that they're using to show where the cases are. Washington State at that point was still at the CDC having 1 to 9 cases. That's actually been bumped up to 12, which we'll see in a subsequent slide. The map can be found at the CDC. If you just Google CDC and vape illnesses, it'll take you to their lung injury page, and this map and all of the national statistics can be seen there. So healthcare providers, as I mentioned, in Washington State, it is now a reportable condition. And this is a slide of what has been sent out to healthcare providers, what they need to be looking for. Again, just talking about lung-related injuries where vaping products have been used. And they have, as we mentioned, the pulmonary infiltrates in the absence of any other infectious process going on. And they are encouraging healthcare providers to ask about the certain products that they're being used. Is it primarily, nicotine products? Is it THC products? Are they flavored products? Are they just tobacco flavored products? And the different types of products that are being used, as there's different ones out on the market. And there's actually a process now through the state of Washington where if the FDA and the CDC are willing to collect the products that the patient has been using and actually test those, because they're trying to figure out what is different now. Vaping's been out for quite a while, but what is the case now? Why are we seeing these injuries happening? Why are these illnesses occurring at this point in time that we didn't see in previous years with people using these products? So here's information for Washington State. We are up to 12 confirmed cases in our state. That consists of King County, Mason County, Pierce County, Snohomish County, and Spokane County, with King County having the highest number of cases at 6. Age range, CDC breaks it down. They start at 10 years of age. I don't know. I haven't heard that we've had any cases that young. But that's just the breakdown. They break it down from 10 to 19, 20 to 29, 30 to 39, 40 to 49. And again, all of this information is available on the Department of Health web pages. If you just Google DOH Washington vape associated, or even vaping, you'll get to their page. So the majority of cases have been in males, so 58% have been in males, and with the cases that have reported vaping THC-containing products only were 2 cases, nicotine-containing products only were 4 cases, and folks that use both THC and nicotine-containing products was 2, and then 4 of the cases were of unknown products. So I'm sure the patients know what they use, but that information had not been collected. And as of now, there still are cases that are under investigation that have not been added to this late and confirmed case count. Oh, goodness, what happened? Sorry about that, folks. The screen has stopped as there is a shared window closed. Let's try this again. Oh, well, let's see. Part of my presentation is not there. That's interesting. Not sure what's going on with that. But the other thing that I wanted to discuss today was flu illness reporting. I did send that form out to Kathy at the beginning of the school year. So, and I believe she made that available to everyone. So if you don't have a copy, I'm sure Kathy can get that for you. And again, that's at 10% or more absenteeism. And I think that's all I really needed to cover today. Kathy, did you have any questions?
I have a question about just the vaping practice in general and so we've got Kristen, Sarah, and Amanda on the phone. So, excuse me, I'm curious about what they're seeing in their districts happening, you know, if they're seeing a lot of vaping going on, you know, or if this is not as prevalent in our area.
I know that it's very common. My son is 17 and he says everyone vapes. I mean, I think they overgeneralize, but there's a lot of high school students. Oh, you can't hear me? Can you hear me, Kathy? Can you hear me, Sarah? Okay.
We can hear you. I can.
Oh, okay. I thought you were saying you couldn't hear. Anyway.
So I was thinking my head, but I don't know where the rest of my presentation went.
No. Anyway, it seems like it's very, very common in high school students, especially. And he mentioned hot boxing or whatever that's called. I hadn't heard that term before, but I've heard of a student that was maybe hospitalized, but it was kind of third-hand, fourth-hand information, so I didn't really get any more information about that to know if it was even true.
We have definitely have kids, they've been caught vaping recently. So we've definitely had a lot more focus on that the last couple months and just reminding people of our policy. And I wrote a newsletter article that's going to be sent out in our school newsletter this next month about vaping and the illnesses and dangers associated with it. So it's definitely become a bigger problem recently.
And were you all aware of the 120-day, I guess, which law that's been enacted that they're no longer allowed in Washington State to sell the flavored products?
Ooh, when did that start?
Oh, like a week or two ago.
Okay, yeah. I'd heard there was some of that trying to go through, but I hadn't heard it had gone through yet.
Yes, it did. They are banning the flavored So on September 27th, Governor Jay Inslee issued Executive Order 19-03, and that is the rule that was in effect, will be in effect for 120 days. And so you may see places now, there's also signs that have to go up in places that do sell vaping products about that there is a risk of vaping, kind of similar to what we might have seen like for smoking tobacco. But currently, they're only allowed to sell products that are unflavored, that just are tobacco flavor or whatever. So they were avoiding trying to get the kids from using them because they have like the cotton candy and cherry or whatever that appeals to the youth, that they are enticing.
But you said it's only 120 days that this is
For now, yes. That's what is in effect until for then, and then I think then they have to go back and revisit it and make it more, I don't know what they'll decide. If they decide to keep it, I'm not sure how the whole process works. I know that there's been a lot of people who own vaping stores that cater to people who do use those products and are very upset because they said the bulk of their, they do, you know, their thing is we don't sell the kids and but the bulk of our sales are these flavored products. And so you're cutting into our business by not allowing us to sell this, even though we're just selling it to adults. So there's a lot of discussion about that, how it's impacting businesses and retailers. So I'm sure there'll be more public hearings and such about it.
Sarah, I have a question about your article that you wrote. Would that be something that you would be able to share with other school nurses throughout the region?
Sure, I can pass it on. I got a lot of my information from the presentation we heard from the SNOW conference a couple weeks ago from the, who was it? The Snohomish County or Snohomish County Health Department nurse that came to present to us. And so, yeah, I can also pass on her presentation if you'd like. She sent a PowerPoint out that has lots of information, pictures and things. Some of the products I have not even seen yet. So like some of the newer products, they're very fancy, bedazzled type looking things. So yeah, but I can definitely send that on.
Okay, that would be great. Thank you so much.
Mm-hmm.
I think this is definitely going to be more and more coming out. We'll be hearing more about it because, you know, then there's the whole the side of the argument that it actually helps adults quit smoking tobacco. So, you know, there's a lot of aspects to the vaping issue that I think are going to need to get hashed out in the next few months or more. But I think the big thing, just like with regular tobacco products, is, you know, keeping it away from youth so that they're not using it. Because we don't really know the long-term effects of the products and how it can affect kids with their lungs and their growth and development and things like that.
Okay, do any of you have any other questions, either for Stephanie or Joyous, just in relation to other infectious disease issues right now?
No? Okay, great. Everybody's healthy. That's what I like to hear.
All right then. Well, thank you so much for joining us today.
Thank you. Yes.
All right, and welcome, Joyous. Welcome again.
Thank you so much.
You're welcome. All right,
Bye-bye.
bye-bye. Okay, so we continue to be on record, and this is a opportunity now to ask any questions you have in relation to school nursing. I have a few things that I'd like to cover before we sign off, but I want to make sure that you get any of your questions answered before we continue. This is amazing, amazing because you guys are so experienced, you have no questions. I would love it, Sarah, if you could spend a few minutes talking about your experience with the SNOW conference and your award of your scholarship to attend and how that worked out for you.
Yeah, it was, the SNOW conference was awesome. I was really thankful I was able to go. There was so much information. I took about 9 pages of notes from all the different things that we talked about. The main focus was the upstream approaches to suicide. And Dr. Maza, I can't think of his first name at the moment, but he has a book, he and his wife, who are both, his wife is a therapist and he is a psychologist, and they have written this book for schools called DBT Steps A. And what it is it gives schools lesson plans to teach DBT skills in schools. So not doing like the one-on-one therapy, but doing it as a group. Let's learn these skills together and let's make it a part of our education, and give schools a different way to approach, those kind of prevent the tier 1 kids that need that like one-to-one, and get the kids that are, he talked about like a tier system. You have the kind of the baseline of kids who, yeah, maybe they have mental health needs, but they're not quite as prevalent. And then you have the middle tier kids who need like maybe the check and connect every single day, who need that more support. And then you have the kids who are in intense therapy, getting, the one-on-one with a counselor. And so how can we reach more of the bottom base of kids before they get to that one-to-one, and kind of teach those skills that kids need in school anyway. And so he has a book, and I haven't been able to buy it yet, but working with our school principal and just finding out, are we doing any social emotional learning? And she said we are. And so they had started some of those things because that's one of her big focuses too. And just trying to start at the suicide prevention, at the bottom, rather than catching the kids that are in crisis already, and what we can do to prevent it instead of just catch it. And so the other things they talked about were the vaping, and the related illnesses to that. She had an awesome presentation, so I can pass on that PowerPoint and then the article I wrote afterwards. And then they also focused on like environmental school health, which I hadn't thought too much about, maybe in specific terms, but she presented how she goes around to schools and looks at all the little safety issues, like playground equipment that's not up to code, or there's pieces that are broken that are causing injuries for kids, and making sure that there's safe levels of pebbles or some kind of surface underneath the playground equipment, and chemicals in our school labs and things that need to be disposed of properly so they're not contaminating anyone. So focusing on those types of things, and it kind of shifted my perspective a little bit, to be more aware of those. And then also we had a presentation from Stop the Bleed, which I know we've done. They've also had in Wenatchee. And so they had presenter come, and she's from Wenatchee. Yeah, I can't think of her name, but she's out of Wenatchee, and she came and did Stop the Bleed for us. So we actually practiced using the tourniquets that they have in those kits. And so I'm hoping to purchase them for at least one for every building in our school sometime this year, so we can get that going, because we're pretty rural out here, so we don't have very good access to that kind of stuff. So I'd at least like to get that, and eventually one for every bus as well, to have those kits available. Just focusing on that trauma and being able to stop those types of things, if at all possible. So those are kind of some of the major things we talked about. They also did immunization update, of course, talking about some of the changes that are happening this coming year. So one of the biggest ones that they mentioned was that for starting next school year, we have a conditional status for students, right? But what is going to be into effect next year is that on the very first day of school, if they do not have a CIS, they cannot come to school, which was manpower wise, I don't know how we're going to do that, but that's going to be the new rule. And then from there, if they bring in record, then their conditional status can start after that if they need to make progress on something. But right away, they cannot start unless they have some kind of immunization record within to even begin school. So it's not that they can come and they have 30 days. It's kind of a step up from what we already have. The other change is going to be the TDAP instead of, you know how the age, it's age 11, so we use sixth grade as that, but not all sixth graders are 11. And so they're changing it to blanket seventh grade rather than age 11, sixth grade to make sure those kids all have, are actually all age appropriate for that TDAP shot. So that's those are two of the biggest things they're working on, and also just emphasizing the MMR change that we are already been working on, the personal exemption that is now gone. Yeah, so it was a great conference. If you guys ever get a chance to go, I highly recommend it. It was quite incredible. There was a lot of great leaders there, a lot of great nurses trying to work hard to make school nursing known to the legislatures and just get work done, I guess. So there's a lot of good things. One of their other focuses was nurse caseloads. So they were trying to do a Twitter campaign with nurses showing what their caseload was, like how many students they have in their district, and hashtag it on Twitter to say what their caseload, I think it was hashtag school nurse caseloads 2020, and just trying to make people aware, because apparently the legislatures they're big into Twitter, and so that the nurses were trying to communicate with them in some way, and thought that these photos would be a good way to communicate what we're actually having to deal with. And I think I wasn't even fully aware of some of the caseloads that the nurses had. I thought being in my district's 1 day a week was bad with small school districts, but then I see a nurse from Richland who has 2 high schools with 4,400 students, and so that was just a little bit mind-blowing for me, even though I've been doing this for a while. So I think more people need to catch on to that, the need for school nurses. So it was a cool experience, and I need to write my follow-up letter now from the scholarship to tell them how I've been doing or will be doing with all that information.
Well, thank you, Sarah. Thank you so much for going. I'm so glad you were able to go to that. And I'm so glad you applied for a scholarship to help with the cost of that.
Yes.
I have a couple questions or just some comments about some of the things that you shared, starting with the suicide prevention work. I want to make sure that you're connected with the Grant County CHI group, because Grant County CHI is actually their main project focus is on suicide prevention.
Gotcha.
And so if you would like, I can connect you with them because I think that they would be interested in hearing more about what you learned at the conference, and they may or may not actually be aware of this work.
Okay. I used to get the emails for them, but I was never able to go to the meetings because they're on Tuesdays when I'm in Soap Lake. And so I think at some point they just stopped coming.
Yeah, they had their meeting yesterday. So anyway, I do want to make sure that they're aware of the things that you're learning about at the conference and have it linked.
Absolutely.
The other group that you might be interested in connecting with also is the Department of Ecology. You talked about the environmental school health, in relation to playground equipment and, kind of that safe environment. And the Department of Ecology actually does a lot of work around school health as well. Their main focus is really on chemical safety.
Oh, yeah.
And so cleaning agents, for example, what kind of products are being used as cleaning agents? What are the incidents of exposure when kids are exposed to things that they're either allergic to or things that are just either caustic or just irritants, and how to help schools really become greener with their cleaning products. You know, they used to, years ago, put out green cleaning product kits and make them available to districts at kind of a very low cost. Those were paid for with some grant funds, and I believe that grant is long probably gone. But at the same time, it is something to be aware of. They have a lot of information on their website about those types of things, what to use versus what should be avoided in regards to, you know, room fresheners, hand sanitizers, anything that has chemicals in it and can result in allergic reaction from the students.
So are they saying to avoid hand sanitizing?
No, they just make recommendations about products. So
Okay.
better products than others that should be used.
Okay.
Okay. Now, in relationship to Stop the Bleed, the School Nurse Corps this year received a grant funds from Puget Sound Energy. They actually cover our region. I know it sounds like they wouldn't, but they do. And they provided us with enough funds to buy 2 of the Stop the Bleed kits for coursework. So those are going to be available for checkout through the lending library. Each kit is really set up to probably manage about 10 people per kit. Each kit comes with 10 participant manuals, an instructor manual, limb, artificial limb, bleeding material, supplies, different types of bandages, and a number of tourniquets. So it's really set up in a modular system so that you could have, as well as your presentation. So you have a whole presentation prepared for you to present on the Stop the Bleed program. And then you've got all of your kind of tools that you can divide your group up into and have them practice.
There's a place on their website to become an instructor. And so, yes. So they highly encourage that before you teach the program.
That is correct. So you would need to complete that course online and hopefully attend. So now you've attended. So Sarah, you've attended a Stop the Bleed course. So now is the best time to go in and complete the training.
Right.
Yeah. Now, they did just update their curriculum within the last year. So the Stop the Bleed program used to be, prior to this year, more intense and more, I think people felt that maybe it was just more than they wanted to take on. But really, they have simplified the course content and the presentation. And so I think that it is, maybe more palatable for people. They feel more comfortable with it now. And so we would encourage anyone, there'll be a note going out to all the school nurses, particularly if you're already a first aid instructor and a CPR instructor, of how to start incorporating Stop the Bleed. Can just be in addition to your current class content. We also purchased probably, I think we got 4 or 5 silicone blocks. They are, it's just a silicone block that is used to demonstrate gunshot wounds, any kind of a penetrating wound, and they're basically for packing. So people can learn how to pack wounds, and then we also purchased some artificial blood. So all of those things are going to be packaged up in kits, and then you can just check the kit out and use it. You don't have to replenish the supplies or anything. We'll take care of all those things, but they are available free for checkout, and those will be made available both to the school nurse, all of our school nurses, and also if we have EMS folks in the region who also want to teach Stop the Bleed courses, we would open that up to them as well. Okay, and any questions about those? Okay. Immunization updates. I'm going to ask Catherine if, Catherine Graff, I'm hoping you met her, Sarah, at the conference. Catherine is our Department of Health immunization consultant, and I'm going to be checking with her about what kind of information or when we can expect kind of more global information to go out to all the school nurses across the state about the changes that are coming next year, and what the plans are in terms of putting together both community messages, parent messages, physician messages, because this is a pretty big change that's coming. There was a lot of discussion about whether or not that conditional status should be continued, or if, you know, kids should be allowed to come to school when they have not had their immunizations. So a lot of work was done in regards to putting the law together. There is I guess there's two ways of looking at it. Some people feel like it's keeping kids out of school when, the goal is to get kids into school. However, on the other hand, there's also the concern that kids are starting school when they're unimmunized and therefore more, open to potential infectious illnesses. So watch for more information from the state. They will be putting out some more to update people on that. So I think the other question I have is whether or not you have, I guess, any questions yourselves about the changes in immunization reporting. And I want to make sure that everyone is receiving their information from the state with their spreadsheets and their survey links to SurveyMonkey.
I know I saw mine for both of my schools.
I know that Alex is working on that. We were working today on kids, but I need to double check to see where she's at.
Kristen, I think you're speaking to us, but you're on mute.
I was speaking. Oh, am I unmuted now? I am, okay. Having technical difficulties today. No, I've gotten the emails and I've looked at the process. So it doesn't, I've just sort of practiced it, and at first it seemed like it was going to be horribly daunting, but I think it'll be okay.
Okay. Yeah, I think that it is, it's one of those things because they extended the deadline to December 1st that I guess my only concern would be if people decide to wait until like the day before Thanksgiving to try to do it, they might struggle somewhat because it is going to be time consuming for people to get this in. So the spreadsheet, it needs to be the spreadsheet that they sent that gets completed. It isn't really just an Excel spreadsheet of anyone's choice of immunizations. It's actually filling out the one that the state has sent. So that is one option for doing the survey or doing the immunization reporting is just to complete that. And the other one is to complete it and then just load all the information into a SurveyMonkey, which is the SurveyMonkey itself. You can click on it and you can open it up and look at it, but you really can't get past the first page of it. But there is information on the website, and I sent out some links today with a training video from Catherine that goes over the two different types of reporting, and also a little about, well, what does the SurveyMonkey look like? What is it? Because once you click into it right now, unless you're filling it out, you can't get past page 1 to see what it looks like without entering all the school data into it. And so if you just want to look at it out of curiosity, you wouldn't get very far. But it essentially just has your grades in it, so the grades where you're reporting your immunizations are in the system, and then you have to go in and type in. There's no cut and I guess you could cut and paste, but it's going to be a time-consuming process. You just need to enter all of your immunization data into the SurveyMonkey tool, and then when you hit send, you're really submitting it to the state. So either of those methods is acceptable. It's really whichever you and your staff feel like is the easiest method for them.
Do you think that we could use the Skyward old state report to pull the data from to just then input it into the SurveyMonkey?
I think
Or are
you
we
can
gonna have to change?
pull, I think you can pull the data. I'm not sure how easy it would be to cut and paste it.
Well, no, I would type it in obviously,
Oh,
but
yeah.
is it gonna be similar data, or am I gonna have to change the data that comes, or further analyze the data that comes out of that Skyward report?
I would think so.
I did a report just to see what it, to see if it looked like their Excel spreadsheet, and it looks the same.
Mhm.
Okay,
I didn't
Perfect.
compare every, line by line, but I thought, oh, good.
Yeah.
right,
Yeah.
okay,
It should still be, you're just really putting in your dates, your dates of immunization. I think the daunting thing about the Survey Monkey piece is it's unlike with an Excel spreadsheet, you're having to go page after page after page after page, because it's each grade and it's each type of immunization. And I think people who are used to using Survey Monkey would probably think, oh, this is no big deal, and kind of just type it in as they go. I think it'd just be good to look at both of the options and decide, well, who even enters your data? Because different districts have different people entering the data. And so whoever is doing it, you just want to make sure they're comfortable with the process that's picked and they know how to do it. Okay. So do let me know if you have any questions about that as that comes up, though, because I would like to help you in terms of getting that done. I think that this is also another indicator of why it would be nice for people to migrate over to the school module and get the school module set up. Because this is just for this year's immunization reporting. I don't really know how it will look next year. The whole Survey Monkey thing is kind of a trial for them to see what are some better ways for them to collect this information from districts who aren't using the school module. And if you did use it, you wouldn't even have to be doing any of this because your information would already be in the state system. And so there is no reporting that is required. So I do understand that there is some upfront work in regards to getting the school module set up. However, the state is staffed to provide assistance with that. So if you're thinking about doing it, this is really the time to think about getting it set up, because you have from now until really August, or July, to get it all done, so that really your system is totally set up for the 2020 school year. It's not the type of system you would implement now. You wouldn't be implementing it in the middle of your school year. It's something where you are going to want to get some help migrating student data into the school module. So that's going to take some work. There's some parent notifications that need to be done, letting the parent know, that this is where their students' immunization data is going to be. Encouragement for the family to use the MyIR website and create their own accounts. So there's parent education that happens. There is staff training that needs to happen. And then identifying who on staff is going to maintain the school module information. So for example, you could load all of your student information in there today, and start getting it ready. But come July or August, you're going to have new students coming to the school. And so new student information needs to be entered. Now that could be done by, lots of different people. It's not necessarily the school nurse who needs to do that, but someone should be identified as being who is going to maintain that information in the school module system.
now Kathy, schools who are using that school module, are they also still inputting their immunizations into Skyward? Because that seems like you're doing double work.
No, they are, it's a very good question, and no, they are not.
Okay.
They use the school module as their source of truth.
Okay.
And the school module really is the source of truth for the state.
Okay.
Okay, because that is the site that providers' offices will use to enter their information in. That should have, and that's one of the training aspects of the school module. Whoever is entering the data into the school module needs to understand that they are truly entering the data into the Washington State system of immunization record keeping. And so all the information that needs to go in there needs to be accurate and confirmed. It can't be anything that a parent just says. For example, my student got such and such, I think, on such and such date. It would not be that type of information. It would have to be accurate, confirmed immunization records that get entered in.
Okay, so then since it's the Washington State system, do they pull information for the kids who are already in the IIS, or is this like the separate?
Well, it is a separate module in that you have to enter the data into it. So I don't know that there's a way that they pull the IIS kind of backwards into the module. That's a really good question, and I don't know the right answer if you can pull data back and forth between the two of those. The school module is kind of a component of IIS, so it's like a sort of like a little subsystem that was built out of IIS. So certainly, I think if you have a MyIR account and you have your data posted out there, I know that would show up in the school module. You know.
Oh, okay. So then if they did that, then it would link the two?
I would have to look and see. I don't know. Those are good questions, and I would pose those questions right to the school module staff.
Okay.
There, as of last year, there were 2 dedicated FTEs working only on the school module. And one of their tasks was helping schools, for example, migrate all their kids' data into the school module, as well as training. They will help train your staff, for example. Now, last year we heard that their grant might have been reduced, and there was the potential that maybe by this year they would drop to 1 FTE. I don't know for sure that that has happened. We didn't get any updates saying that their number of staff had changed, but it may have. However, the link to connect with them is still the same, and it's the same email address that I sent in the email that went out today about locations of the training module. And in fact, I've seen that presentation once, the one that Catherine Graff did about the 2019 changes, and I actually can't remember off the top of my head how the migration worked back and forth between IIS and the school module. So I'd have to either watch it again or just ask the folks there how that would work. We have at least one district, and that's the Wenatchee School District. As you can imagine, it's very large and has multiple buildings. They're looking at, for example, implementing it only in a few buildings. So I don't know if that would be of interest, Kristen, in OMAC, of just saying, well, you know, maybe we'll just implement this particular system in our elementary schools, see how that goes and get that done, versus trying to do the entire district at one time. I think that would be good questions to actually pose, in your conversation with the school module team to see what is their recommendation based on volume and number of buildings, as well as resources. How do you have one person who enters all this information, or do you have people at each building, for example? Because that would make a big difference if you're talking about one person responsible for all of the data, or you're talking about 10 different people maybe who are entering information at different sites. Okay, do you have any other immunization questions? Amanda, would you like to share a little about your student that you have with the gastrostomy tube and how that is going for you?
Yeah, she's currently back at Children's and was just released from the ICU. So she has only been with us for 4 days, 2 weeks ago. But we now have 3 nurses in Pateras. So my daydream was to work with a team of nurses, and now I have that. We're just here on different days. So that's been kind of interesting trying to figure that out. But unfortunately, the student has not really been here. We're hoping she'll be back in the next couple of weeks. It was going well. So it's just kind of an unfortunate turn of events that she's not here. Though I think Pateras is benefiting from having a nurse here every day. It's pretty phenomenal. I mean, the kids are coming up to the office more. They're bypassing Alex, or that's our health aide. She's sending them up to Rainey, the other nurse. And then Elvia is here on Fridays as the migrant school nurse. So I think we're kind of in a transition of trying to figure out how to divide and conquer and what our roles are. And but it's exciting, and I hope our student comes back soon. And it's unclear, what her new health needs might be after this next discharge from the hospital. So, yeah.
So your student has a gastrostomy tube, and do you want to explain then why do you have a second nurse?
She had to have Solu-Cortef on hand in the event of an adrenal crisis. So we had to staff a nurse to be here full time for that, which it sounds like that's not uncommon. The Elvia had some experience with that as well. But it kind of threw our district for a bit of a loop as to how to deal with that. Going from one nurse 1 day a week to needing full-time nursing care here in the event of emergency. So, yeah.
What was it that did you say that she needed in case of a cutout?
Solu-Cortef.
Oh.
Yeah. So she had a brain tumor and then had surgery, had a stroke during surgery, and is in a wheelchair, has a G-tube, has made a very amazing recovery, but has a lot of serious health needs. So, yeah. Do you guys have anyone with Solu-Cortef? No. Yeah. Yeah, it threw me for a loop because, I mean, being new to this, I sort of envisioned that was something that could be delegated. That was my first thought, was how is that delegated? Like, would there be a para? And yeah, obviously it turns out that's not the case.
So there are similar things going on in other districts right now. In your case, Amanda, the rationale for the not delegating was the fact that the Solu-Cortef needed to be administered IM. So there was no one to delegate IM administration of medications to. We have a similar situation in another district where the order is for rectal diastat. And there's no PDA, there's no full-time nurse, and there has not been any ability to exchange that order for any other type of medication administration that could be delegated to others. So, there could potentially be another district in a similar situation with a need for a second nurse to fill in for that particular student because right now they only have someone in the district 2 to 3 days per week. Another district that's having a situation is one in which they're going to be bringing in a student who has a trach, And, you know, just looking at what the particular needs of that student are and what will be able to be delegated to other staff. Now, luckily, in that case, there are a couple of school nurses who are working in the district. And so I think that they'll be able to, between themselves, manage quite a bit. But still, you know, there are often needs when the school nurse is not available, and, you know, how is that student going to be managed? So it is really difficult for districts when you have conversations about needing a full-time RN. They're not used to, you know, that as a requirement. And in that case, in the case of your particular student, it was a little unclear at the outset what exactly that student needed and why they needed it. What was the rationale, for example, for the IM injections? What was that something that really needed to be done at the school, or could it be something that would be done at home? But as it turned out, it was, you know, the unfortunate part for the district was no, it really needed to be something that would be available to be given at the district.
Yeah. It did seem so tricky because they live so close. And, you know, the stepmom was the main caregiver. Just seemed that there could have been a way. But I think it's great that we are now all here.
Mm-hmm. And for those of you who aren't familiar with Amanda's newest addition also to the district, we do now have a migrant health school nurse case manager position. And Elvia Martinez, you know Elvia. Elvia's been the school nurse in Brewster for several years, and Elvia decided to take that position. So it was something that was developed through OSPI's Migrant Health program. And Elvia, in her role, is able to cover 3 different districts. So she spends 1 day a week in Brewster, 1 day in Bridgeport, and 1 day in Pateros. So she manages a caseload of students who fall under the Migrant Health Program, and she maintains her caseload at each of those 3 districts and essentially serves as the school nurse case manager in her role when she is in those districts. She also continues to do 2 days per week as the school nurse at Brewster. So.
I just will say one more thing, that both Elvia and Rainey and myself were there last week for the hearing and vision screening with the spot screener, and it was phenomenal. It was, we were ahead of schedule. We could have screened 2 more schools. It was wonderful. The spot screener and all of the help that we had was great. So.
Yeah, I really appreciate that ability that you have now to kind of be a threesome, you know, and really be able to cover. And I don't know if Susan Sloan also was involved with that work at Bridgeport.
I'm not sure.
Okay.
Yeah.
Which kind of makes you a foursome if you cover that district as well, because pulling all your resources together like that really will benefit the district.
Yeah, huge.
You know, just the speed of the work is amazing.
Yeah.
So good. So you have all your vision and hearing screenings done then?
Yes. Yep.
Mm-hmm.
Yep. Okay. It felt a little late, but I was not ready to do it without the spot screener.
Mm-hmm.
So, yeah.
So Sarah and Kristen, do you think Amanda's late in getting her vision?
Okay.
No. We just did North last week, and we still have to do East and school, and I do the high school more in January, February.
Oh, good. You know, I can be so hard on myself for certain things, and so I felt like I was late, and yeah.
I normally try and do my small schools in October, and here it is almost end of October and I'm not there yet, but I do have it scheduled now, at least for one of them. And I'm borrowing the spot screener that Linda Baker has in Soap Lake that she gets from the Afraid Eye doctor who loans it out to the schools. So
Oh,
we're
good.
going to be sharing that to, I normally use the kits and
Oh,
get all the volunteers, and it's quite the process.
it's gonna change.
But
It's gonna change your life. I mean,
oh yeah,
we
it's awesome. We've used it in Soap Lake before the last few years. I just have never borrowed it to do that. So now they bought an extra one at the eye clinic to specifically for the schools to borrow, and so we are all gonna be passing it around.
awesome.
It's exciting. It's so
that
much
is-
faster.
It is. Ours was so chaotic last year, and we made a few changes to just bring in a small groups at a time, and then basically just lined them up and did the vision, and then off they went to the hearing, and it worked so much better. But it's nice to learn from one's mistakes too. I brought the whole all the classes in it kind of staggered last year, and it was chaotic. So, but those spot screeners, great tool.
Well, great. Well, thank you for sharing that. So we are at our 1 o'clock time frame, and we're probably going to get bumped out of our recording. So I just wanted to thank all of you guys for logging in today, and I hope you found this helpful. We have a guest speaker set up already for the November program who's going to be talking about pregnancy and pregnancy support of teens in the region, and they serve a wide region of student needs. So I hope you'll be able to join us, but if not, I will record it again, and we'll send the recording link out after this is posted. All right. Well, thank you so much. It was so nice seeing you.
Thank you.
All right. Talk to you later. Bye-bye.
Right.